welcome to the Nth Degree, where we're talking about the latest trends, technologies, and innovations happening across the health and media spaces. I'm Amanda Brito, and I'm here today with my guest, Christine Mormilli, Vice President Engagement Strategy, to talk about the evolution of EHR-based media. We all know single-channel approaches are no longer effective in healthcare marketing. So today, we will explore what a truly integrated EHR engagement strategy looks like and showcase how leading brands are moving beyond traditional display to leverage precision targeting that resonates with both HCPs and patients. Hi, Christine. Let's get started.
Hi, Amanda.
So
Good
good
to
to see
see
you. So
you.
let's dive right in. And why don't you talk to us about why this approach is not a nice to have, but it needs to be a very strategic, integrated approach for paid media?
Absolutely. And I can't agree more. EHR is essential for every media strategy and media plan in today's world, especially in the integrated world that we've come into with just the enhancement of the EHR platforms as a whole, and technology has exploded in coming years. So really thinking about where EHR is often seen, it's often seen at point of care. So point of care is really just the place where these physicians are meeting with their patients, making key diagnosis decisions, and ultimately deciding how they move forward with drugs, scripts, procedures, so forth. So it's really essential for any marketer or brand to be in that landscape. And the EHR platforms, the technology has just continued to evolve with the evolution of AI and the integration with healthcare systems. So would love to talk more about that during today's conversation.
Yeah, awesome. Well, I said in the intro that we were going to be talking about what a truly integrated approach looks like. So could you walk us through that, Christine?
Yeah, absolutely. There's definitely a lot of evolution in that as well. And EHR has been around for a very long time, but what hasn't is the just different ways and methods of buying EHR. So ultimately, there's three core ways that historically our teams have been looking to buy and integrate EHR strategies as part of their media plans. The tried and true way of buying EHR media is through direct relationships, through partners or legacy partners who have independent EHR platforms that offer the direct advertising in those landscapes. Then we have the evolution to the aggregators who consolidate the advertising opportunities on those different EHR platforms and pulling that all together to really have a one-stop shop to help you really reach physicians at multiple touch points within multiple EHR platforms. Finally, the newer model, which is really the hottest thing being talked about in this business right now, is the integrator model. That's where the EHRs have these direct connections with the HL7 integrators, is partnered essentially with healthcare organizations to make determinations on how to really enter those EHRs. And that's really opened the door to get into systems like Epic, who haven't historically allowed EHR advertising. Through entering the door and getting into the floodgates of the healthcare system setup, you're able to advertise on Epic, on Cerner, because the healthcare systems are allowing that to take place.
That's so insightful. And I guess to that end, what kind of questions should brands be asking of their supplier network to ensure that they're getting the most sophisticated targeting capabilities?
Yeah, great question. Ultimately, understanding what that supplier partner is selling and why it's unique to other suppliers in the landscape. More and more suppliers are evolving and having EHR capabilities added to their portfolios. So ultimately, understanding where their ads are placed within that EHR, whether that's direct through an aggregator or even an integrator, understanding if it's on the home screen or at the point of diagnosis or the ordering screen will really impact what makes the most sense for your brand, depending on the brand's life cycle. So ultimately, if it's in a more launch now approved life cycle, it may make more sense to be at the home screen, at the forefront, to really make that splash versus a legacy brand that's been approved for a few years and you're just trying to convince switching from one product to another.
Got it. Let's switch gears for a moment. What metrics and optimizations should brands be collecting and watching for in their campaigns?
EHR has historically not gotten a lot of direct engagement, and that's primarily because the physician has ultimately been using the platform just to, view the order data, view the patient data, and ultimately just decide on how to make a script. So they're likely not going to click on any ad within the platform itself outside to any third-party website, even if it is your own drug. So it's really meant to just think of it as an awareness driver, then look at measurement from an ROI perspective. And that's why we always recommend with EHR, as we do for other point of care tactics as well, to implement third-party measurement studies when possible, when setting up the campaigns at the beginning. That ensures that you and the HR partner have full transparency with your client or marketing team to determine best practices for how you can just evolve and measure success. Ultimately, they're really great at driving awareness. They do drive ROI, but you have to really have the third party measurement in place to institute that and really prove that out.
Nice. All right, so let's leave our audience with something really concrete and actionable. Can you give us a couple, let's say three, Christine, ways that they can have a successful EHR campaign?
Oh, great. That's another great question. All great questions, Amanda. I would say that, first of all, don't be shy with including more than one EHR partner on your plan. I think it's very easy with all the partners offering these capabilities in this day and age to switch from a direct partner to an integrator and aggregator. You really need multiple types of EHR platforms and partnerships to really see a successful EHR campaign because they have different touch points, they have different reach, they have different healthcare system relationships and pipes into the HL7 integrations. That all of that is really just important because you're reaching different physicians at different touch points throughout their, diagnosis journey. I also think too that having more than one placement with the EHR just increases that frequency to the target physician. It's okay to have some overlap, knowing and understanding the different places where the ads are being positioned within that system as they're logging in to view the tool. So ultimately, I think just the combination of those two will have a recipe to a successful marketing campaign and ideally high ROI.
Nice. Thank you so much for being here with us. I think this is a really exciting space that we've heard about for a really long time, but just like everything else, there are nuances and innovations. So I'm sure our audience has a lot to walk away with. And we will see you next time on the Nth Degree. Remember to like and subscribe.